Thank you for joining us on Diaspora Lounge again today. We're talking about fibroids. This is a condition that predominantly affects women of Black race. And I live in Canada, and I know that there are lots of women here in North America who have spoken to me. I've seen them posting on forums, talking about their condition and situation with fibroids. Some have even had their marriages in problems because of this. And the treatment for fibroids is not always very easy. And so we reached out to an expert who has successfully treated this issue with many, and you can check him out later, Dr. Richard Okoye of the SaveAlife Foundation. He's an expert and he believes in this treatment, having successfully done it. If you live in North America or anywhere outside of Africa, it might be even more difficult because this is a problem that is like at home with us. And so they don't have to deal with this as frequently as much. So I'll kind of say that there is a limited information and limited treatments if you're outside of it. Let me just play a little intro about the SaveAlife Foundation and Dr. Okoye, and then we'll start to talk with him. Thank you for being with us.
Meet Dr. Richard Okoye, the Sun 2022 Public Service Icon Award winner, is the chairman of SaveAlife Group of Companies, SaveAlife Mission Hospitals, SaveAlife Tech Hub Limited, SaveAlife Communication Limited, owners of SaveAlife 88.9 FM, Afri Trust Medicals, and also the president of Dr. SaveAlife Foundation, the pioneer of the first modern dialysis and kidney transplant facility in the South, South, and Southeast regions of Nigeria. In his effort and determination to revolutionize healthcare delivery in Africa, Dr. Richard became the first medical doctor cum tech guru to build the first fully digitalized hospital in Africa with EMR that operates robotically and offers more accurate diagnosis and treatment than the human brain. With the aid of radio frequency, SaveAlife Home Clinic app delivers professional health solutions to remote communities where there is no internet and access to medical professionals. He also established the ISO certified group of hospitals, SaveAlife Mission Hospitals, with zero hospital acquired infection status, equipped with the first digital cath lab in Nigeria for heart, neuro and cardiovascular diseases. Dr. Okoye is set to launch the first digital medical university and research institute, which includes, among other specialties, medical hardware and software technology. As part of his human capital development vision, he has sponsored the training of doctors and nurses in super specialty courses abroad. He is the author of 24 best-selling books and the presenter of the popular TV show You and Your Health, airing in Nigeria and Ghana. He is now on a mission to improve the Nigerian life expectancy to 70 years by the year 2025. Do join me to welcome Dr. Richard C. Okoye.
Right. Thank you very much for joining us, Doctor. This is Dr. Okoye that we're talking about here. He has successfully treated many cases of fibroids. And so you are lucky to be hearing from the experts. And after this, you can reach out to him. We'll have his information in the description box. And you can talk with him, ask questions, and get information about treatment with him. Please go, Doctor.
Right. Good morning or good afternoon or good evening, wherever you're picking up from. And it's my pleasure to be here. And while I have to spare this very time, it's quite important because the subject of infertility, which also fibroid tend to pioneer, has been one of the major marital crises, we do have. Contrary to what is obtainable in most Europe and America, where people can divorce without reason. In a number of our own cases, here and majorly, the issue of childbearing has actually been a very major factor in that very ugly scenario. So that's why when it has to do with this very subject, I give it as now a calling to be here. Now, with respect to this particular subject, it's a very important one because there are a lot of there's a lot of misconception people tend to have about it. But let me first of all put it to every one of us. Fibroid is a gynecological tumor which you can touch. It can be separated from the womb. As a matter of fact, it's not within the womb. Let me put it is not tied to the womb. It is something that when you open the womb, you can chill it out like egg. So in other words, it is not a spiritual problem. Let's establish it's not a manipulation, as some of people will be imposed out of desperation women go through. They tell them all kind of stuff. It's not by any form of manipulation or one witch or somebody after you. No, it is a gynecological problem found in women. It's not found in men because men don't have womb. All right. Now, looking at that particular subject, it presents with a form of symptom that will tell you have fibroid or I don't have fibroid. But looking at the subject or symptom is that a woman may have fibroid without a single symptom. In other words, you can have fibroid without knowing you have fibroid, except only when you go for pelvic scan and you discover, say, there's fibroid here. Now, the symptoms that fibroid can give to a woman, number one is that it causes, let me put something that will be helping you, because some people will say, no, I have fibroid, but I'm not bleeding, because bleeding is the commonest cause or symptom of fibroid. So when you see your menses becoming more, then something is wrong. In that case, fibroid is associated with excessive menstrual bleeding. How will I know if my own is excessive? One is that menstrual blood does not clot. That's one unique thing. It has a chemical that liquefies it. In other words, it makes it not to come like ordinary water. To tell you that you are perhaps bleeding more than you ought to, if your menses come out with pieces of blocks of blood, lumps of blood, it is an indication that at that point, shedding your own blood is beyond the aspect of the conventional menstrual bleeding. So it causes excessive menstrual bleeding. Yeah, some people will say, no, I'm having pain. If the fibroid you have is now getting you to have this kind of unusual and very painful menstrual pain that some people may not even go out, may not even go to work, that may be associated with another condition of the womb, which is called adenomyosis. If you do scans, sometimes it may still look like as if it is fibroid because it causes a similar thickening. When you 1 minute, please. Okay. So it causes the same kind of thickening. Are we together?
Yes, I said bless you.
Are we together? I need a response, please.
We can hear you. Oh, you can't hear me.
Okay, thank you. So it causes some level of, that thickening will be there when you do a scan. So sometimes it mimic as if it's fibroid and all that. Nevertheless, we will talk about the difference between them and what could be done, because that one is as a result of thickening of the muscle of the womb. It's usually very unfortunate. That will be for later. Now, another symptom you could have is that this woman, conventionally, a woman should not feel her womb. There are a lot of stuff going out there where they say that your womb before, let them set it and all those stuff. No person, including a medical doctor, can touch the womb of a woman except that womb has something in it, like that fibroid we're talking about, pregnancy or issue of adenomyosis or maybe a tumor. All right? Every woman, if you look at the size of your fist, is the exact size of your womb originally. Now, that's supposed to be under one bone called pubic symphysis toward the downside. God hide it behind that bone, so that even if somebody hits you on the front, that bone should protect the womb. However, in a scenario where there is fibroid, the fibroid will now grow and start making the woman feel something hard. It gets me thinking that one of the things about a woman is ecstasy. And you can see some women having that fibroid that can now become like pregnancy. What is the cause of that, you may ask me? One is the issue of fear. They've told them a lot of things. That's why I would like anybody who want to ask questions here to ask. So we eliminate those fears and save their womb before the worst happens. So the issue of fear, no, they will tell a lot of stuff, which we look at it. Another thing they will tell you is a spiritual problem. Another thing they say, if you do fibroid operation, you will not get pregnant. Or if you
Yes.
get the fibroid done, yes, if you get the
Or that you must
fibroid
remove
done,
it
they,
with the womb.
yeah, they may remove your womb, or they may be in position that the fibroid will regrow again. We're going to look at all of that. So let me be able to take off those fears at this very point before we go further. Number one is that from the numerous testimony, we have done thousands now of fibroid. I have about three ladies from UK and one from Sweden, which we may do because of the chain of one or two, or then maybe the Sweden, or we do tomorrow. We do this fibroid at least minimum in a day, 5, 6, 5, because people fly from everywhere to come. All right. Now, to understand this, I
And
have seen women.
you are based
If
you are based in
if,
Nigeria. Just for clarity, you are based in
yeah,
Nigeria.
I based in Nigeria, but I have a software company with a Falcon over there in LA in US. And also I have a medical equipment factory in China. So I try to work around. But here we have hospital group that works. That is to say, no, I don't know the stuff they have over there concerning nothing works in Nigeria. This is our testimony that here it works. All right. So we will be able to go about that one later. But looking at that particular subject, a number of women have done surgeries, not just only save a life. Let us not make it as if for the peculiarity. People get fibroid operation done and achieve pregnancy. But why those that didn't achieve, what could be responsible? One, issue of pregnancy is not a one gender problem. If a man, as our society give him this kind of sacred cow mentality, immunity to our men, so in as much as it's achieving erection is okay, so nobody cares to know more about them. If a man has low sperm count, let the woman go and remove fibroid 10 times, the woman can get pregnant. So a man with low sperm count won't achieve pregnancy irrespective of whatever the wife is up to. Are we together?
Yes.
Right. Now, going on that, also, some will now leave the fibroid and the fibroid will grow to the point of scattering the architecture of the womb, perhaps pull the fallopian tube to some other location and all those blocking the fallopian. So at the end of the day, you find that even if you take the fibroid, the connection between the sperm and the egg, which is the fallopian tube, is already compromised. So that very person will still not be able to achieve pregnancy. Other alternative option of IVF and the rest cannot be considered. Are you with me? But a woman can get pregnant, can achieve, get fibroid operation done and achieve pregnancy established. Going further also, they say no, they say that if we get it done, it will come back again. Now, let's establish it here. The fact remains that any woman that has fibroid has a tendency of growing another fibroid if left over the years, because the tissue differentiation could happen. Now we use what is called diatemy. Diatemy helps you that if you cut, it sees the blood vessel. So it gives the doctor the opportunity even to weed out the least of the fibroid as he feels it. So most times people get fibroid done here, issue of saying that no, I'm gonna come back couple of years is not usually the case anymore now. So if you do thorough weeding, you can have a very good time, can have your babies. And once you start having your babies, all those other ones will just be at rest. Right.
May I ask a question about
Now,
that?
what is most important? Go
May I
ahead,
quickly
please.
ask about that? This weeding, I understand that because I've heard people talk about another fibroid afterwards. So this weeding, is it done with an equipment that helps to check even the tiniest ones? Can they be seen?
The one?
Even the tiniest ones,
The
the
Oh yes.
tiniest.
You know, let me. Yeah. Now the issue is fibroid is not. It's just like, okay, take your womb in a picture of a pure red meat. All right. You know, when you are cutting your red meat, you can feel the texture. So if
All
there
right.
is anything that is boil-like or boil, you can easily feel it. You
Okay.
understand? So it's not as if it is something you need microscope. If you just touch if you feel the texture of it, you may feel it's supposed to be free, okay? But if there is anything that is looking like a lump, you can just nicely and take it out and just close it. So you can, that's the weeding I mean. To take on,
Okay.
even those the big ones are very visible. Those ones, you just touch it, you can easily get it done and get the womb nicely packaged in what is obtainable right now excellently well. Now, there's major concern that most of our women suffer in Europe. In fact, worse in the UK right now, the majority of them have been on waiting list 1 year. Even get
Yeah.
pelvis scan done. To get the result is even another problem issue altogether. I don't know whether they are having it as a delayed tactics to make most of our women enter menopause, not to have children. I couldn't just fix it, you know. So why that kind of delay? While fertility is a time-dependent issue. Now let's get it. Fibroid has a genetic and racial inclination. Has genetic and racial inclination. What do I mean by that? If you get to Germany right now, you may scan the entire German women. You will not see one of them with fibroid. Not one. So also these Caucasians and all that, fibroid has been found to be of African black racial origin among our women. I don't know why, but study has shown that most of our women have high level of estrogen when comparing to that of the Caucasians. Nevertheless, while that could, over the time, if nothing happens, can help to differentiate into fibroid, it is also important to know that that's what makes our women to be more fertile than the Caucasians. That's what also will give our women this our normal this shape where they make us, become they view our women, that.
Right. Okay.
Tell me.
Now that you say this, is there a way to know what level of estrogen a person has that is sufficient so that, let's say, 20 is the
You could
level
throw away
that
the
is
other
fine?
one.
20 is
You
the
throw
level
away
that
the
is fine. So that
rest.
if I have 50, then I know that maybe I have excessive. So maybe I can do something to reduce it. I just had to ask that
No, no,
question.
no. I understand. It's
Oh, I
just
think
a
you're muted.
range.
Oh,
So
this is only, I think you're muted.
Sorry. Yeah,
You're
yes, I
muted.
muted myself because I'm just enjoying I'm having a little bit of cough, so I don't want to interrupt. But I was
Okay.
shaking my head. I was like, nah, how is that possible? But I will allow the doctor to continue speaking.
Okay.
okay, dear. So what happens here is this: there's a range, just like what I say, genetic. If you see some of our women with this our front and back, it's not same as you can see in India, in China. All right. So
Yeah.
these are the way we are built genetically. So it's not as if we are measuring it as if we go back some and say this one is not enough for us or this one is not enough. No, genetically is so. But the problem in it now is that because most of our women, having migrated to Europe, to North America, to and all that, they now be in an environment where these things are not a routine practice. So when you get to see a doctor over there, they will either tell you, some may not have even seen it. They will say, no, I don't understand what it's like a tumor. What if you are having a cancer or something like that? But now, for these people to operate on this, having not been having a routine surgical procedure to develop mastery, it end up either they now ask our women take off the womb, or they will say no, and we can only remove the ones that are within the womb. You can leave the rest. Even when you are doing hysteroscopic myectomy is the one you go through the vagina, get to the womb. Maybe if you get within that room, you can cut off some that may be projecting right there. But what is projecting right there, the base may still be right inside the muzzle of the womb. So what you are taking out is no consequence when it has to do with what. Yes, do you understand what I mean? So that's why they are having that very problem over there. And most times our women end up going in, come out, nothing. All the other embolization, HIFO and all that, when the time comes, we'll be able to answer some of the implications and their limitations. Obviously, some people will say, no, there is one drug or one product. They say if you take that very product, okay, you're going to have the fibroid shrink. But that is not true. That is a complete lie. I will admit here, there are drugs that can shrink fibroid if taken over a period of time, 6 months, thereabout. And that's what is called a group of drugs called gonadotrophin releasing hormone analogs. These drugs, you can find them in the form of goserelin, you can find them in the form of Lupride, Lupron, Zoladex. They're all there in the market. Are we together?
Yes, we are.
Yes, very much.
Okay, interesting.
Yeah.
All right. So those drugs, they're there. And what do they do? The mechanism of action of those drugs means that if you give that injection every month, every 28 days usually, it will stop the ovary from producing estrogen. That by not producing estrogen, it may not make the womb to be able to say, no, I don't have anything need. So it may begin to reduce its fibroid like somebody you are starving. You get that?
But is that a good thing for someone who hasn't had her babies to even try?
Intelligent question is that. The implication of it is that when taking it over time, the person will obviously not be seeing menses. The person can go into what is called medical menopause. All right, because at that point, it's stopping the ovary from working, and the person who, most of our women actually talking about fibroids, say have a need of having a baby. So you are invariably trying to block what is most essential also to them. So it is absolutely not indicated for when it has to do with fertility related. This now, somebody may say, no, Dr. Okoye, what you're talking about, I have one product that works. Now, I take it from here. If somebody will tell you about any product, the first thing you should do is to go and do a pelvic scan. Check out the sizes of those fibroid, the locations and all that. All right, some may not pick all, but at least that's something. Now, take the product for 1 month to avoid their kidney being impaired. 1 month, after which, go back and make a comparison before and after. If the things are still staring at you, you don't need a prophet to tell you are being deceived. So that is the acid test.
That's a good one. Well, let me quickly tell anyone who may want to call in. because I see somebody watching there. If you want to call in to ask the doctor a direct question, you can call us on WhatsApp on one is our area code at 850-996-9919. 850-996-9919. Call us on WhatsApp. Actually, let me try and place that in the description box right now. Please go on, doctor. Sorry for the interruption.
All right, fine. So when it has to do with the issue of drugs, there is no known drug that has been established today, medically speaking and talking, that could be able to take fibroid out of the womb. Now, we look at all of the technological, inventions. You look at the subject of what is called embolization, ultranatural embolization. You may have heard of something like that before. Now, this is the principle. There are 5 routes whereby the womb receives blood supply. Okay, you receive blood supply from the vaginal blood vessel, from the collateral, inferior and superior mesenteric blood vessel, the collateral, but the main one is coming from the ultranatural. All right. And study has shown that of all these 5 blood routes, that it is only the ultranatural that supply fibroid. The rest don't. So the invention says if we block this main artery, all right, that invariably, if it's not supplying to fibroid, the fibroid will likely shrink over time, but the blood supply can still go through the other 4. Okay? But all depend on the size of that very fibroid. And in a number of occasions, it may still not be in position to do much for the big fibroid associated with our own women. The other one is the HIFO, which is a wave. The shortwave therapy has almost a limitation. I remember one occasion we operated a lady in 2012. She went to India to do HIFO. And the fibroid was still there and all those guys. She now came back to Nigeria. When we opened her up, because of those vessels alternative, just like you have a scenario where major road is blocked, the alternative routes now will get expanded. We saw the surface vessels that should be so insignificant when you are looking at the womb properly. All of them hypertrophied. That's looking very, a BB pipe. When we saw the womb, it was looking cancerous. But that was like trying just to maneuver some manipulations, to be able to have it. So that is one, it's important. There are different forms of surgical intervention. The laparoscopy is the hysteroscopic myomectomy here. But right now, to enable the fibroid be completely eliminated, as it were, womb nicely packaged, to be able to achieve pregnancy, because 2 things that have been wonderfully achieved in this time is, number one, safety of this very patient. So most times they don't sleep again during the fibroid. They will be gisting with the doctor while the process is going on. And most times there's no need again for blood transfusion, because with the aid of that diatom, if he cuts, he sees the blood vessel. And then even if it's a bleed, I just touch it, you seal it up. The beautiful advantage of that is that, contrary to what is obtainable before now, you have a scenario where you use a knife to cut, blood will be flying from different sources, so you have to use a suture to tie the mouth. In a number of occasions, you try to tie, you may not tie, you do a figure 8, trying to hold it and all that. So most times they finish fibroid operation with a lot of sutures all over the inside of the womb. That sutures all over and attempt to tie, compromise the integrity of that particular womb. But now, because of no longer cutting so much, you can touch blood with it, so you can nicely have flesh to flesh healing, and also be in a position to be properly strengthened. So now, fibroid operation can be beautifully and excellently done. Like one that came in from Ireland, she, on the 3rd day, she went to a shopping mall here in Port Harcourt. So it's beginning to be something quite interesting as it were right now. So you have a question there?
Yes. 1 second, please.
Yeah, while you're coming up, Uzo, thank you, doctor. I have had a myomectomy and everything sounds super familiar to me. I wanted to ask, is there risk of scar tissue developing as a result of this surgery? Because that's another fear that I hear.
Inside the womb on the skin, you mean?
Wherever really, but I've just had this fear of, scar tissue developing, as a result of surgery. Now, I don't know if it's dependent on the skill of the medical professional or anything. Honestly, that's why I'm asking you.
What I want us to say also others, the scar tissue you mean, is it the scar tissue? Because when the womb itself, you don't see now after the surgery, isn't it?
Mm-hmm.
Yes. So are you talking about the incision?
No, I'm not
How
talking about the
this?
incision. I'm talking about inside. Okay. So I have
Okay,
had someone who had a surgery and then went back for a pelvic scan and being told, that there's scar tissue, developing it.
okay.
Or is it this whole suture thing you were talking about?
I will now explain that to you now. There is something that happens sometimes, particularly if you have the type of fibroid that they call it submucous fibroid. So
Mm-hmm.
women will say, I have fibroid, but my fibroid is, they say it is not in the womb. Have you heard of something like that before?
Yeah.
Right.
Yeah.
Most, that is a misnomer, all fibroids are inside the womb. In exception of a very rare fibroid, they call it ligamentous fibroid, very rare, maybe on that anchor that hold the womb. But this very fibroid location could be in 3 layers. You have the outer layer, they call it the subserous. So fibroid may grow about that axis. So that's the type that will grow very big. The tummy will be quite big, all right? There's one that can grow inside the muscle, the middle layer that is the muscle layer. They call it intramural fibroid. And there are ones that will now grow inside where the menses normally happen. Those ones are the ones that causes excessive menstrual bleeding.
Yeah.
All right.
Okay.
Now, I want to establish something here. For those ones inside, that's why the issue of now best approach now becomes necessary. If you see this, my 2 palm, as long as I'm alive, these 2 palm will never come together because it has a covering, they call it keratinized squamous epithelial cell. All right. That's what they make it just rub over each other. However, if I use a razor blade on this and now cut off this one and pull it out and pull it out, if I keep it like this just 10 days, it will come together. I may not be able to separate it. All right.
Makes sense.
Good. Take that picture into the womb. The womb is covered by another layer of cell that is similar to that of the mouth. It's called columnar epithelial cell that are tiny. That waterproof-like covering is one enable the 2 surfaces of the womb to be rubbing each other without garment. All right. So why you see sometimes some people that will do fibroid, do abortion, if they over scrape off that waterproof and these 2 come together, you see the person say, I used to see my period 4 days, but now it has come 2 days or sometimes I'm not seeing at all. So that's what is called Ackerman syndrome. Now, iatrogenically, when I'm talking about now, I'm doctor working now because of surgery. When the fibroid is inside that very womb, when the doctor wants to take off that fibroid, because that Chinese surface, the fibroid are using to make its own back. So when you're pulling the fibroid, that very lining will also follow the fibroid and go away. You get that? So because of this nice arrangement on no bleeding, that very 2 surfaces can be nicely be opposed and the line will be very straight. Quite unlike the one you will just put on stitches anyhow, so the surface will now become rough. When you use your hand to sew and when machine sew for you, they don't look same.
I can imagine.
Yeah. I liked making it for you to be appreciating it.
Yeah.
It makes sense.
Yes.
It does, yes. That you've explained it very well. Thank you.
Yeah. So when you take that bites in that rough-like manner, some naked flesh will be teaching out. So later they may come together or make that place look rough. That's what they will now see and say, oh, there are scarifications. So, but in the lesson spread is if you close that place that is actually where the fibroid gets out, you can put on a balloon, they call it intrauterine catheter, to separate the place for 7 to 10 days, depending on the doctor's choice, so that the two surfaces will not come together after the.
Does it create any issues if you have that scar tissue there?
Oh, the
Does it
scar
create
tissue
any?
is talking about, there's this one. Okay, you get it. When you have a wound that didn't heal nicely, you discover it used to be thicker. And the blood supply around that area will not be like very free, like the normal surface. So when the baby finally implants there, you may not be receiving enough blood supply. Do you understand? So, so they will now be looking for where they may lead to miscarriage or something in that nature.
Okay, that makes sense. Wow. So does it? This question, does it increase the risk of cancer?
Fibroid is a non-cancerous tumor, non-cancerous, established over the years. There's only a peculiar but very rare nature. They call it sarcomyoma. Do you understand me? When it becomes a sarcomyoma is a type of fibroid, but it's cancer. At that time, they call it womb cancer. It's no longer like fibroid cancer.
Okay. All right. Yes. And for women who have attained menopause, should they have any concerns if they have a little bit of, they have a fibroid or fibroids that aren't large and they don't even notice, but maybe the only issue is that maybe they bleed a little from time to time. Should they have any concern about it, or should they wait it out?
Any person
will it be shrinking? Will it be shrinking?
No, yeah, I'm coming. Let me remove the one that is of a more that's more consequential. Any woman that has reached menopause and see bleeding of any kind is a danger sign. It should never happen. So once that happens, the person should rush to the hospital. Let's be sure there's no endometrial cancer that is being dealt with. All right. So
even if can a woman in menopause have fibroids?
Yeah, you may have had fibroid before going into menopause. But as the principal earlier mentioned, that when the estrogen is also not there, there's likelihood of the shrinking of the fibroid. Nevertheless, all depend on the size of the fibroid. If it were those insignificant ones, yeah. But if the fibroid is very big, it don't become more
Right. But then that woman can now bleed, right? She can still bleed even while in menopause.
No. Once you enter menopause is established when you're a woman that is of that age, you start seeing her menses 6 months.
Oh, because I thought that the fibroids bleeding is a different thing, so that even without
something has to cause the menses now, and that thing that is causing the menses is the estrogen produced from ovary, and ovary don't tire as at that time of menopause.
Oh, did you understand my question?
Yeah, I do. Yeah, but he's explaining as well. So he's saying, if this woman had fibroids, right? He just explained it. I'm still trying to see what your misunderstanding is. So, and if a woman is still bleeding after menopause, like then he said, it's a red flag, right? Is it menstrual bleeding you're talking about? It can't be menstrual bleeding. Because then it's a red flag. It can't be menstrual bleeding because the estrogen level it's not, it's greatly reduced at menopause. So it's a red flag. That's what he's trying to say.
What I meant was she's not seeing her period, but because she had fibroids before, so can she still see any bleeding after her periods have stopped?
Fibroid does not come. Fibroid is not responsible for the bleeding. The only thing that happens is that the estrogen builds that inner lining of the womb, preparing for pregnancy. But when
Yeah.
pregnancy is not there, it shares, they call it now menses. The
Yeah.
impact of fibroid is that the blood vessel passes through the muscles of the womb to reach to that inside, all right? Which, if it start bleeding, the womb will contract. By contracting, it closes the blood vessel that may be going there, so menses will stop. But if there be fibroid in between, even when the womb contracts, just like you put a stone while trying to squeeze a towel, you will not be able to squeeze out everything because the stone is blocking the fence squeezing to hold the blood vessels not to bleed. So at that point, the vessels will continue to pour out the blood because nobody is
Mm-hmm.
holding it firm. You get that? So that's why the blood that will come out will now start clotting because it's no longer menses. It's not the normal
Okay. Okay.
loss.
Okay. That helps. That helps. Right. Hmm. All right. But can one prevent it before it's like if one feels like people who have say longer or heavier menses, are they more susceptible? And is there something that they can do to prevent, like maybe diet and anything that can
It's not
help
food,
them?
it's not food related.
Because they talk about sugar.
Nothing.
Really, you have you heard that, Onyi?
Yeah, people will say, so I had a myomectomy, I had fibroids. I'm the healthiest person I know, right? I don't eat sugar, I don't do that. And even when I discovered I had it, it was as if it just came out of nowhere. I
Mm,
upped my, reduced, cut this off, cut this off, cut this off. And I just kept shaking my head while Dr. Koye was speaking because it was a doctor friend told me this thing is not going to shrink. Go take it off, right? But I was the healthiest person I know. I didn't have heavy flows before or after anything. So really, I just agree with the doctor. I hear,
mm.
we hear all these things on
Yes.
social
Even
media.
for
I was
people
on the
that
page and
even
someone
for
said
people that
she
have suffered
drank.
it.
Yeah,
Yeah.
someone said she drank something and doctor, someone said she drank something and the fibroid literally fell out like she expelled it like she was giving birth.
The
You hear
first,
all sorts of things.
Are they lying?
what it means is that the womb also
Listen to
came
the
out.
doctor. Oh, I don't know. No, that was what they said. That like
The
they spelled it.
fibroid
And
is
two
slightly.
people also confirmed it under that post.
Oh,
You know how
that's
it
the
is on
thing.
social media.
Marketing strategy. All right. The fibroids are rounded inside inside the womb itself. So if it falls out, it means that the entire womb came out. If the person should go and find out whether the womb is still there, maybe he had to try prolapse.
Hmm. Okay. I did have someone that had been a fibroid sufferer for years, and I spoke with
Mm.
her at length. And one of the things that she recommends now is reduction in intake of sugar because she had it for a long time and it really messed up her life. So maybe it's just, okay, these are the things that I did. So it's not necessarily that it's helped, but maybe she's including it as these are all the things that I did. So just do this as well, just in case. Maybe that's what it is.
No, it's not a food related. It's purely hormonal engagement. Purely hormonal
Mm.
engagement. So, and it's
Mm.
within the reproductive age group. Thereafter,
Right.
every other
Yes.
thing.
Yeah, Uzoka, can I quickly plug this in? I don't know how long we have here, and
Please, please.
I don't want the doctor to go. Yeah.
Yes.
So,
Yes.
thank you so much for coming on. I'm not giving a vote of thanks yet. Uzo, I don't know where you found Dr. Koya. I didn't know you have access to celebrities. But if you could lay hands on him again, doctor, if you could honor us again with your presence, if you could talk about endometriosis, that is another,
I was
and
thinking of it in my mind,
yeah,
but
because
yeah.
endometriosis is so silent, at least with
Yes.
fibroids, at least you know what you're dealing with. But
Yes.
endometriosis is so silent and it's
Yes.
causing so much havoc. So please, if you could come on and talk about endometriosis, that would be perfect.
And many people can have it and they don't know that that's what they have, right?
If you
Well,
have, we have endometriosis, sorry. If you have endometriosis, invariably you
Cow,
will
Udo. Huh? What do you say?
If I have endometriosis, obviously the pain will
Yes, the
weaken you
pain.
to consign.
Yes,
In addition to some other things that are involved, it's not a sweet subject to
yes.
discuss
I'm very
because
interested in that conversation. I am very interested in the endometriosis
it's not
conversation.
a sweet one. Yeah,
I
because the
know, I
outcome is
know.
usually unfortunate, depending on the presentation, because of recurrence dimension of it. And that's where you will not think of all this drug we are talking about causing menopause has to also come in even
All
after
the
you have done.
Zoladex and all that. Yeah.
Exactly, because I've also heard. Anyway, when we get to that, thank you very much for
Mm.
mentioning that, Onye. Yeah, thank you so much. Okay, Doctor, thank you for being with us today. I think that this conversation is a very worthy one. I will share and overshare it because people really need to get educated on it because we've heard all sorts of things that people are making adjustments to their lifestyle in ways that leave them disappointed because it's like after everything I've done, this condition still has not changed or waned. So because they're getting misinformed, and that's why people need to get this information and education. Thank you so much, Doctor. I will leave
I
anybody who
believe
comes across this, I will leave doctor's information and description in the information in the description box so that you can reach get across to him to have your fibroids issues taken care of by God's grace. Thank you. Thank you, Onyinye. Thank you for being here. So,
my
Doctor,
pleasure.
Yeah, thank you
right,
so much, doctor.
right. Okay, so,
Yeah,
and
we'll
thank you
keep
for
in
being with
touch.
us on that prayer lounge on this episode, everyone. Share this information, share this video if you have found it helpful so that your friends, because some people don't even talk about it, they don't let people know that they're going through this because for some people it's embarrassing. You need to know that for some people, their lives have literally been changed because they are stuck dealing with this thing, especially those that have heavy bleeding. Their social lives are cramped and they have mood swings. They are sometimes terrible people to be around because of the pains that they're going through. And so you don't know what is happening to that person. Maybe this is what they're going through and they haven't shared it with you. So just share this information so that people can get to know about it. And remember, Doctor may graciously honor us again with his presence so that we can discuss endometriosis, which is a real big and painful issue. All right. Thank you for being with us on Diaspora Lounge. If you've enjoyed this, remember to like our video and subscribe to our channel so that we can continue working and bringing you more useful information. Everyone stay blessed and have a beautiful rest of the day. Bye.